Thinking about trying that viral DIY skin treatment you saw online? Well, hold up. From lemon juice disasters to homemade sunscreen fails, our medical estheticians are here to reveal why these at-home hacks could harm your skin and what to do instead for healthy, beautiful skin. Stay tuned for expert advice you won't get anywhere else.
Welcome to The Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Graper Harper Cosmetic Surgery in Charlotte, North Carolina, The Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper and Dr. Robert Graper, also known as The Doc Dudes.
Welcome to The Doc Dudes. I am Dr. Garrett Harper, along with
Robert Graper
and
Evan Zook.
Dr. Zook's here in spirit, but we also have all three of our medical estheticians. So we're super excited to have our special guests, Angie Adamson, Melissa Myers, and Candace Workman. That was alphabetical, by the way. We're diving into do-it-yourself skin treatments and why they're generally not a good idea. So, this is a topic I see a ton, and I see a bunch in jest, but I also see like legitimate posts on crazy stuff. I feel like it's like, is it salmon sperm that I'm like reading about right now?
Probably snail. No, I don't think it's
God.
snail.
It's salmon sperm facial.
It is. It really is. And people aren't joking around. They're like using that. I mean, we could insert so many jokes, and then I say bad for saying that word. It's like, it can.
But I think at the end of the
just
day,
look at Dr. Graper, and my mind just starts going to bad.
Why even get a salmon
inappropriate?
involved?
Was the salmon? Did he agree to it? You know what I mean? Was the salmon okay with this? I can't believe the PETA people aren't on this. But there's all sorts of crazy wackadoodle stuff that you read about or that you see about online, especially in this like social media age, right? It's not like it takes a whole lot of brain power to make some of these videos and come up with stuff. And I think the majority of time it's truly people trying to get a laugh out of stuff, because I just can't imagine that there's a lot of truth to this. We've been studying the skin for a long, long time, and we know how to take care of it. At least you three do. I don't. I use bar soap, so that's probably not great. Don't look at my skin. Look at y'all's skin. That's what
pretty
looks
good.
Beautiful. Okay, so first let's define what a medical esthetician is, right? So Dr. Graper, we've got this kind of bullet point here that helps direct our flow. Tell us a little bit about like the definition of a medical esthetician and what makes our three so great.
Well, I would ask them what they think this is, but for me, it's a trained esthetician, certified in her craft. She went to school. She's got experience, and she's looking to improve skin health rather than fluff or buffing your skin that doesn't have any long-lasting results.
And it just happens to be she in this office. I'm sure that there are great male estheticians.
Do you know any ladies?
I do not.
not personally, but we've had some excellent aesthetic male trainers.
That's cool.
They are fun.
Yeah, super cool.
Yeah, haven't you noticed they tend to like those trainers better than the gals that come in? Certainly the equipment reps that come in. Who was that guy?
Yeah, the guys that look, not Tarzan.
Yeah.
Yeah, we don't talk about him.
Oh,
anymore,
they came
right?
to every one of those trainings.
Wow. Oh, well, let's hear all about it. The majority of time, it's state by state, right? Like as far as what rules are for medical estheticians. North Carolina has its own policies compared to Georgia or something like that. But what's great that about, I think, Graper Harper Cosmetic Surgery is that we all work under the same roof, right? And so while it feels a little compact sometimes because we've got so many providers under one roof, we're all here to kind of bounce thoughts off of each other and also patience between each other, which is what's so great, right? The majority of the time you're going to see estheticians working, alongside plastic surgeons, dermatology offices, those things. Of course, they can have their own practices somewhere, but it just makes sense to make it kind of a functional component to a cosmetic practice. Certainly it flows really well and vibes really well. I've told patients, and I think I've said multiple times on these podcasts, that the foundation, the most important component of taking care of yourself as we age and to look our best and to be our healthiest is skincare. And I mean, it just is. It's just a fantastic way of fighting back the aging process. So talk a little bit about the services that the estheticians provide here at Graper Harper Cosmetic Surgery. So Melissa, introduce yourself and kind of let us know what services are offered here.
Hey, alrighty. Melissa Myers, and I've been with Dr. Graper and Dr. Harper for 25 years this July. So at this office.
Yeah, you started as just a little middle schooler. That was amazing. Yeah, that was
baby. And again, as Dr. Graper said, we are concerned with general skin health. That is the primary drive. Healthy skin is naturally a prettier skin. And people heard of like lunchtime peels. Those have been going on forever and ever, and they are the bread and butter. Think of a lunchtime peel or a little light chemical peel as your exercise routine. It's exercise for your skin. The trainers, the girls will definitely get on board would be the BBLs, the Halos, the Morpheus, things like that. Things that do a little more than just scrape that little layer off. They do a little more work underneath the skin, but we can treat your face. Skin covers your entire body. Not only peel the face, neck, chest, hand, arms. I have peeled shins. I have peeled thighs. I have peeled tops of feet. You can treat those areas as well too. So, yeah, when you think of your face or your skin, don't just think of what you see here. It can go everywhere.
Okay, Angie. So, what are some of your favorite devices, procedures, anything that you, and don't worry, I know some are more conducive to times of the year, but what do you just love? What are you excited about? What if, somebody came to you and you said, I can only have one device or one treatment plan? What would you say that is?
Probably a form of microneedling, whether it's RF microneedling or microneedling by itself. It's a great way to stimulate that collagen. You add the RF into it. It's a great way to tighten the skin.
Yeah.
Can help with texture, tone. Doesn't help so much with pigmentation, but we have other devices for that, like chemical pills and stuff. But just a great way to keep that collagen stimulated.
Yeah, we love it. And of course, collagen and elastin are two of the protein fibers that dissipate as we age. So it's critical to kind of keep those at good levels. If this kind of goes to one of those myths or something that you see for the DIY thing, what do you guys think about like taking supplemental oral collagen? Does that help at all?
I don't know. I've never seen any proof that it works. I mean, I don't know. I don't know.
Yeah, no.
That's always my answer.
No, I will say, like Angie said, we don't know because who's really going to study it? But our skin is the outward reflection of what's going on inside.
Oh, 100%.
Literally.
You and I had a great conversation today about eating habits and health and nutrition and all those things. So there's no doubt about that. But I do think that the majority of the data would tell us that drinking collagen and trying to absorb it through our gut is not the best way to replenish our collagen as we age. So I know there's been all sorts of fancy milkshakes that people used to bring here and tell us to give to our patients before and after they undergo treatments, and I just don't see a whole lot of that working well. So
I didn't. Betty Fleming, when we had her on, the nutritionist said, nah, that doesn't help.
Yeah.
As long as you're eating a regular diet. Now, if you're not eating a regular diet, different answer.
Right. And that can certainly help you with, but protein is what you need for a lot of that. So, but drinking these collagen drinks and things like that, I think are probably, well, I mean, I know they're not really helping you. But a lot of times somebody who's taking the steps to drink collagen are probably doing other things that are helping. It's like one time I read that men with six packs live longer, like abs, not like six packs of beer, like abs, six packs live longer than men that don't. And you're like, oh, really? I mean, is it the six pack or is it what they have to do to get the six pack, right? So really kind of, you got to take all these things into context. Okay. Candace, how about you? What's like one of your just really love this treatment? And if there is a particular time of the year that's best for the treatment that you love, let us know. What do you think?
If I had nothing else to choose from but one, it'd be Halo. And that's because you can get the brown spots off, you can take care of texture, and it's 1 week downtime. And I feel like it can take you further than a lot of things that we have. So,
and you can dial it up, dial it back. What is Halo?
Tell us what Halo is.
So Halo is a fractionated treatment. So it
Laser.
Yep, it's a laser. It's a certain handpiece on our laser that can put little micro injuries into your skin, which will stimulate collagen. But
Same concept as the microneedling.
Yeah, but it's going to help your pigmentation. So sun damage, it's going to help acne scars. It's going to just give you a glow. That's why it's called the Halo Glow. So that's what the Halo does in a nutshell.
Super cool. And I don't know that I asked you, Melissa, what's your favorite?
Don't make me pick. Yeah, no.
Right.
And I guess with the girls, I mean, I've heard the microneedling. We all love that. Halo, we love that. And an easy one, if you're kind of a little bit of a chicken, BBL. It is an old standby. It is great if you have those little vessels that are like a road map on your face. If you have brown and you're afraid to go through the Halo, this is a good interim step above a chemical peel. And it's the next step is a personal trainer, and it can really clarify the face, but without scaring a new patient.
Right. I especially love it when every once in a while I get back there and have you guys zap the little vasculatures on my nose. And that feels great. I think they enjoy it too.
Yes.
Right? They enjoy watching me cry. It's so great too, because women will get back there and it's like nothing.
Candace
you can
just
laser
laughs
their
at me.
you can laser their entire
Man
body.
up, I've heard that so many times.
All right, so let's talk a little bit about these skincare myths, and then any that aren't kind of listed here that I think are funny I may bring up, okay? And so we'll just go around the table, right? So I will start with Melissa, and then this is just kind of how we're seated. Okay, so Melissa, the myth: sunscreen is only necessary on sunny summer days and when you're outdoors. What's the truth?
The truth is, if there's enough light for you to see, there's enough light that could potentially damage your skin.
Okay.
So
That's a good way of looking at it.
We are not living in a box. Put your sunscreen on. Put it beside your toothbrush. Do not forget. Protect that skin. You have invested money in it, and you do not want it, crunchy and icky and cover up. We have sun protective clothing now that does a great job. So sunscreen.
Okay.
Like brushing your teeth.
Yep, so even on a cloudy day.
Absolutely.
What if I'm sitting on my porch and I've got, I'm underneath the awning and it's a screened-in porch and it looks like I've got some shade kicking on me?
I'm still going to go, especially if you have a pool or sand or something. You're getting reflection. People that tell me, I just sit under the umbrella and stick my legs out. I'm under the umbrella. Put your sunscreen on because it's bouncing like a mirror right onto your face.
Right.
Sorry.
I love it. And I've told this story multiple times. I'm sure you guys have heard it. But I remember when my wife and I were early on in our courtship, we went on a trip to the beach. And we were sitting there, and I was coming down, and she was already at the beach, and she had like a big, huge hat on. She was underneath the umbrella, like there wasn't any sun touching her body. And I said something kind of flippant to her, and I was like, hey, you remember when like blonde hair, blue-eyed, and tan was a hot thing? And she was like, yeah. And I was like, it still is, thinking I was all like funny and stuff. And she said, if I decide to stay with you one day, you will be very happy that I have protected myself from this sun. And 20-something years later, she's exactly right, because she looks like she's 20 years younger than I do. I forget to put on sunscreen, as evident of last spring when I came back from a day at the Masters, and literally I was Red Lobster everywhere that I wasn't wearing clothes. Pretty amazing. All right, so Angie, more skin products, and the more you put on of those skin products is always better.
No, not always, or never, actually.
Yeah.
It can clog the pores. It can irritate the skin. It can actually cause you to produce more oil. So if you tend to having breakouts, you're going to actually cause more of a problem, not help it. And dry, scaly skin doesn't look good.
Sure.
So we want to turn the cells over. We want to make it healthier, but we don't want to dry it out and make it all scabby looking. So go by the directions. Usually pea size amount on pretty much everything is usually enough.
And then, so this kind of begs the question, because I don't know this, I don't mean to put you on the spot, and I realize that every sunscreen is a little different, but I do have people that ask all the time, like, how often do I need to reapply my sunscreen? Is there a general rule of thumb, or is there somewhere to look on whatever sunscreen you use? And I would also comment that a really great sunscreen is a really great investment.
Right. Yes. And all of that is labeled on every package. So we have some that will say every 40 minutes. Some will even say not water resistant or waterproof. So if you get in the water, you need to reapply it. And I would just get in a rule of doing that even if it is waterproof or sweat proof. But yeah, most of them say on the package. Some are 40 minutes, some are 50, some are 80. So it just really varies.
So what are a couple of your favorite sunscreens?
My favorite is the Elastin tint by Elastin Hydro Tint. That one is sweat proof and waterproof. It is tinted, so you can wear it daily as a makeup. And probably the AOX spray by LTMD is a great body one. Goes on nice and clear. It's not going to leave you white, but it's going to protect you.
Yeah, that's what I was always scared of, is being like the kid with the white face, the nerdy, dorky kid. Now as a parent, like, I just don't care.
Yeah, they've done a good job with the zinc, being able to micronize it so it's not going to make you white for the most part. The ones that we carry, they still have those over the counter, but we have them that they'll blend into the skin very well.
Dr. Graper, what are some things you do when you're out and about, like sailing and at the beach? Because I know you're an avid outdoorsman and take a lot of fun trips. What do you do? What's your routine as a man to kind of protect your skin from the sun? And you know, I mean, if you wear a rash guard and wear a hat and do all those things, great. But what do you do personally to keep that radiant skin?
I like a good high-quality sunscreen so it doesn't block your pores and get acne from it. Yeah. Frequently, I'll put on some vitamin C underneath that, which is also an antioxidant, sun protector. And, you know, you put it on before you go outside, because if you wait 30 minutes to put it on, then you've already got 30 minutes worth of sun. Yeah. And some people, depending on their skin type, that's already, you know, a level 1 burn. Yeah. So they're already pink and getting sun damage. And just because you're not getting brown doesn't mean you're not getting sun damage. So the UVA is what you can see in the brown, but the UVB is the damaging rays for aging and cancers. So you got to use UVA, UVB protection and put it on before you even go out. And, you know, that's one of my generational wealth ideas, is to come up with something that will tell us when we need to apply.
Wouldn't that be great?
Yeah. I've been thinking about that for 20 years and still haven't.
You probably just gave some like brilliant chemist some idea or something. I wanted
to give,
right?
say, like have a Tar Heel emblem, and you put it on and you put your sunscreen on, and but when the Tar Heel emblem goes red, that means your sunscreen protection is over.
Oh, that's super smart. I thought you were thinking about like the whole body application would change color. Like you were sitting there like, you're turning violet, or something like that, you know? Like, no, you're talking about like having something that can monitor
an indicator.
Well, I mean, you're going to edit this out, right? Like, I don't want that idea going out to anybody else. We need to work on this. That's a really great idea.
Maybe buy an island.
While we're talking about that, am I wrong? I may be spreading this myth. When you look at a sunscreen and it says like SPF of 30, I was always under the impression that 30 meant that it takes 30 minutes with that sunscreen to get the same amount of UVA and UVB rays that you would have in 1 minute if you weren't wearing anything. Okay.
30 minutes is, the SPF of 30 says it'll take you 30 times longer to get the same amount of sun as it would have if you don't have any protection. And so if it takes you 10 minutes to get a slight pink, now it'll take you 10 times 30 minutes to get that same amount of
So not like
pink.
far off. I wasn't like crazy far off with what I was saying.
I would have given you a partial credit.
Okay, good.
And like it depends upon your Fitzpatrick type, because somebody with a Fitzpatrick 4, 5, and 6, they can take more sun than the 1 and 2, the fish belly white, the sizzle when the sun sets you.
Yeah. I don't know what Fitzpatrick. I'm like whatever. I'm so white that I'm green sometimes. That's kind of what I feel like. So I probably need to reapply. All right, Candace, can you shrink your pores?
You can make them look better, but not necessarily shrink them. You can exfoliate them, which can clean out the debris, the product, oil, which would make the pores look better. But no, you cannot shrink them.
All right, so that's where retinoids and niacinamide and those things can help kind of clean things up, make them look less obvious. But no, a pore is a pore is a pore, right? That's kind of genetically modified. Okay, Dr. Graper. Retinol.
I was not even there that night.
Well, it's like, am I just going to go to Melissa or am I going to include you? Otherwise, I'm just going to start, All right, so retinol, which you're a huge proponent of.
True.
Since I've known you for the last 10 years, all I've heard is everybody should be on retinol. Myth, retinol thins your skin.
Wrong.
Okay.
It actually thickens it because it stimulates your skin to make collagen and elastic fibers, and it improves the texture. And retinol has 85% of the positive effects of Retin-A and only 5% of the downside, which is flaking and dryness and redness and
I was about to
itching.
ask that because I feel like I remember when my mom had Retin-A, right? And you kept it in the refrigerator or something like that. I forget. But yeah.
So the problem with Retin-A is it works great, but nobody can tolerate a course of treatment because you get so scaly and flaky and like a snake. So you quit using it and now you're not getting any benefits. So if you're using retinol and you can use it every night and not get that same dryness, then you're using it all the time and it works.
Cool. All right, Melissa, there's no better question for you than this one coming up right now. And I do not mean natural by you and I had a really great discussion today about what we put in our bodies as far as food and how ultra processed. I mean, I could do our own podcast on that kind of thing. But natural when it comes to skincare, right? Is natural always better with skincare?
No, natural can be problematic. People have allergies, so there you go. And we like to use things that have been tested, studied, that actually have an effect on a cell. Again, we're wanting to change the skin on a cellular level so that you see that beautiful glow on the outside, what the public sees. So disagree.
Okay.
All those natural things don't have the power of the synthetic things we've made.
Yeah.
So what do you want, natural or do you want results?
Right. It'd be great if you could get a combination of both. But until the natural, the lemon juices, the coconut oils, essential oils, all those things, that's not to say that they can't help and give some improvement, but certainly not to the degree that science-backed skincare regimens can provide.
We use the science. We do what works.
That's right.
We
I
do
love
what
that.
works, yeah.
Okay, Angie. Dermaplaning, I feel like this is what we used to talk about when you'd shave. You'd start to get a little bit, you'd say, oh, if I shave or something like that, it's going to grow back thicker. If I dermaplane my face, will it make hair grow?
No, it will not change the texture of your hair. The only thing that can change that are the hormones in your body.
Yeah.
So no, you can shave and it will come right back the way it is.
Yeah. So it's not going to come back thicker. It's not like it's going to be that kind of peach fuzzy, and then all of a sudden you're going to have a coarse, graded back hair like Dr. Graper.
Nope.
So I think where this really applies. Okay, that's one for you. I think where this really applies is women who have a fuzzy face and they're afraid of getting dermaplaned and scraping off the outside layers of dead skin and hair because they're afraid they're going to be shaving like their husbands.
Yeah.
Right.
That's just not so.
I'm going to interrupt for just a minute.
Yeah.
Look at a man's face that shaves.
Yeah.
Typically on the upper portion, the forehead, around the eyes, across the cheeks and all, that's where we'll see the brown spots. We'll see all the damage. They have shaved so much that mostly that lower area where they constantly exfoliate with a blade is not near as damaged. So there is that. Yes. Agreed.
Love that. I'm going to start shaving more. Okay.
You are clean shaven.
No. I used my Manscaped. That little guy gets
cleaned it up first, right?
Cleaned it up.
Okay.
Cleaned it up a little bit.
I'm talking about the utensil.
Yeah, we got to get pictures or something like that. So I had to look a little bit better. Plus, Kristen hates my haircut, so I had to do something to make myself look a little better. Okay. Candace, oily skin doesn't need a moisturizer. It's already oily. What do you think?
I have mixed reviews about that, but sometimes if you don't moisturize, your skin can overcompensate and produce more oil. So I just think there's different moisturizers for different people. We have oil-free ones, we have heavy ones, so that's how I would answer that.
Yeah.
I think you should always have a moisturizer in your drawer.
Yeah.
And yeah, yes.
Yes.
So if if you get somebody with really dry skin, do we need to improve the transepidermal water loss and then they wouldn't have dry skin and not need moisturizers at all?
What's transepidermal water loss? What's that acronym? What's that name?
Tool.
Tool. TEWL, the tool.
Don't be looking at me like
I'm
that.
not.
Well,
I'm not.
Dr. Obagi says that if your skin is oily, it's healthy. If it's dry, so you need exfoliation, right? So
Right.
is that where you're going with that?
No, I was going to say, if somebody comes in with really dry skin, we wouldn't put them on a moisturizer necessarily. We'd put them on something to improve their transepidermal water loss, something that's
Like a hyaluronic acid.
yeah, or
usually
whatever
works well.
is
Yep.
the best treatment for that. And you might use a moisturizer as they're getting improvement and don't need it anymore. But the treatment for dry skin wouldn't be just a moisturizer, right?
No, not at all.
Well,
Okay.
and I feel like healthy skin doesn't need a moisturizer.
Right.
Because if you're healthy, you're producing your own oil and you're able to keep it. Like I don't use a
And
moisturizer.
you got a better tool.
And you've got a better tool.
Careful.
This close.
Careful.
No,
I
and
saw
I will
you
tell
look
you-
right at me.
Seasonal. I mean, skin is seasonal
Yeah.
because our environment,
Oh,
when
boy.
we are sleeping at night
Especially
in the
North
wintertime.
Carolina, are you kidding me?
Well, in the summer, we have the humidity, so our skin can actually glean a little bit of water from that, as does our hair. Everybody notices frizzies. And in the wintertime, that's when I tell my patients, run your humidifier, make sure you're on a hyaluronic, because an oily skin can be a dehydrated skin as well.
Yeah.
So you can have an oil production, but a flaky surface. You're lacking the water, and you also don't have a good barrier. So yeah, that's why we do a consult. I mean, this is not at the counter. Put this on your face; it'll make it glow. No, we're going to help get your skin corrected.
And probably important for these people to come see you guys like as the seasons change too, and you can also get used to product and need to change product and
Cross-training.
Some companies come out with better products, so it's pretty lot to think about. Okay, so we're gonna start firing these off because we're going over time. So I'm gonna start with Dr. Graper.
Me.
DIY skincare mistakes.
Yeah.
Okay. Using lemon juice directly on your skin. Why is that bad?
Because you could be putting in your tequila and soda.
I agree with that.
I mean, why would you put it on your skin?
I agree with that. That's a waste of good
Right.
lemon, right? And just a caveat, like margaritas and were designed to have lemon or oranges, not limes. Back when tequila started coming over to the United States from Mexico, apparently limes were the cheapest. So that's just kind of what got assigned to it. But if you really go to a tequila place in Mexico, it's oranges, Lalo tequila, and oranges are fantastic. Or it's lemon, and Fortaleza are really great too. All right. So just my 2 cents. Okay. Next one is also going to you. We're going to do 2 at a time.
Good.
Baking soda as an exfoliant or cleanser. Why not use baking soda as an exfoliant?
Well, because the pH is out of control.
Okay.
And that leads to dryness, irritation, and breakouts.
Okay. All right. So don't use baking soda to exfoliate. All right. To you, Melissa, I got a pimple, and overnight I'm going to put some Crest toothpaste on there, or Colgate. I think people used to say use Colgate. What about using toothpaste on a pimple?
Oh, please don't.
Okay.
Please don't do
All right,
that.
why not?
Because, those have menthol agents, peppermint agents. Those can cause caustic burns in very sensitive skins.
Yeah.
And if you have an acne eruption, that's already an inflammatory issue going on. Don't do that. We have specific things that we can give you to help reduce a pimple.
Okay.
Definitely. But yeah, be careful what you put on at home. You don't want to make a bad situation worse.
What about those little pimple patches?
I'm still not a fan.
Okay.
I have seen too many people that now they have the pimple and then they have a burn around the pimple from the patch.
Really?
What's the patch got in it? Like
Tea tree.
It's
A lot of
usually
times tea tree
salicylic.
oil. Salicylic,
Salicylic.
yeah.
Okay, all right, back to you also, Melissa. DIY microneedling, derma rolling, or dermaplaning without any training. If I'm just like, you know what? I watched a YouTube video on this. I can do it. Why do I need to go see Melissa, Angie, and Candace? What do you say to that?
Please don't try this at home. Disclaimer. A lot of the tools that we use, the Yeah, microneedling, everything's disposable. We
Yeah.
do not reuse it on you, and we certainly don't want you reusing anything that you probably haven't sterilized properly at home. That can lead to a nasty infection. So not only are you trying to get rid of that little wrinkle or
Yeah.
that acne scar, now you've had a bacterial or a staph infection that you've got scarring
I've
from.
seen some awesome
Yeah.
injuries from people dermaplaning themselves too.
Oh,
Those
well-
have been great when they try to don't hold the scalpel exactly right, and they're just like, oh, I think you just hold it at a slant at an angle.
No,
this will
yeah.
probably be fine. Yeah.
Please do
Yeah.
not order on Amazon. I think you can get a small child off of Amazon these days anymore. Don't order blades and a handle. That I mean, those are scalpels. We're
Right.
using a scalpel. It's
Right.
blunt-ended. Thank you, Lord, for that.
All right, Angie, undiluted essential oils. Essential oils was all the rave, and I do think essential oils can be great for some things, but talk to me about undiluted essential oils for the face. Why is it bad?
They're too strong, irritating. You could be allergic to it, could burn.
Yeah. All right. And then what about over exfoliating? Like, why is that bad? I remember I used to have this. It was Zur men's products, ZIRH, and it was great. And it had this like, I would wash my face with it kind of every day, and it had like a sandy kind of component to it. You know what I mean? Like little grit in there. And I'd rub it all over my face, and you'd feel like you were all perfectly clean. But I noticed that my skin kind
had
of
a
changed a
tool
little bit when I
problem.
did that. I did.
Yeah,
I've been
that's-
told that time
yeah.
or two.
Exactly. You're going to dry out your skin, so don't do that.
Okay. So don't over exfoliate either. It's bad. All right. It strips the skin, sensitivity, redness, breakouts, all those types of things. And don't use coffee scrubs, right?
Yeah, no.
So I do read about that and see that along with the salmon
Coffee,
sperm.
sugar, you can kind of
Those poor salmon, or maybe
tear the skin.
I don't know, maybe not poor. I don't know. Okay, and then Candace, to you, how about like those patches, the Biore skin strips, the application glues for blackhead removals and things like that? What do you think?
I wish blackheads were that easy to get out.
Yeah.
Technically, what you're seeing on that strip when you rip it off is dead skin cells, and people think that it's a pore or blackhead coming
Yeah.
out.
So it's the
Anyways,
filament,
it
right?
doesn't.
Isn't it called a filament?
It doesn't work. It
Tailor
can irritate
filaments.
the skin.
Okay,
So no,
don't use that. And then what about rubbing alcohol as a toner?
no. That's all I got to say about that.
Really bad idea.
Yeah.
It takes adhesive off. Don't use
Please
that on
don't.
your skin. Yeah.
Super bad, yeah. And then homemade sunscreen, we know why that's bad. What about you've got you've ordered your own stuff online because you know best and you know that you like this kind of product and that product, and you got a whole kind of dressing table with them all on there. What about mixing these skincare ingredients without understanding the compatibility? Dr. Graper, do you have a opinion on that?
Well,
why that might be bad to not have an expert like the three ladies we have here working on all that?
Many of the products that the ladies do use and prescribe are mixtures of those things, but they're in the right proportions.
Yeah.
And using them without the right proportions, of course, could damage skin.
Okay, so everyone, no matter what your age, women and men can benefit from medical skincare treatments and products under the proper direction, aka seeing one of our medical estheticians. Medical skincare can take years off of your appearance. If you're interested in learning more, call our office or visit our website. Make an appointment with one of these three gals who all started when they were in elementary school and have been working for 20-something years, right?
Good answer.
Good answer. All right. If you have questions or topics you want us to cover on the Doc Dudes, head to ghsurgery.com and click on the Doc Dudes from the homepage for a link to submit questions. Subscribe so you never miss an episode. New episodes drop the last Tuesday of each month. You can find the Doc Dudes on Apple, Spotify, YouTube Music, and everywhere you listen to your favorite podcasts, as well as through our website. Don't forget to follow us on Instagram and Facebook for the latest on new episodes and our practice. I would like to thank Melissa Myers,
Thank you, Dr. Harper.
Angie Adamson,
Thank you.
Candace Workman,
Thank you.
and Dr. Grapes. You're the
And
man.
Dr. Zoom.
You're the man. I'm not here. Ooh, I'm here in spirit. All right. Thanks for this episode of Doc Dudes, and we'll catch you on the next one. Ciao.
Ciao, baby.